Today, we're diving deep into one of the biggest medical stories of the last 100 years or so, lung cancer. We're going to look at its history, unpack its biology, and see where the fight against it stands today. Let's get right into it. So let's start with a really important question. If you went back to the early 1900s, lung cancer was actually considered pretty rare. So how on earth did it go from being a medical curiosity to the #1 cause of cancer death worldwide? The answer, it turns out, is a tangled story of society, science, and the human body. All right, first up, let's go back and trace the origins of this modern epidemic. To really get a handle on what this disease is today, you have to understand where it came from. To really understand the scale we're talking about, just look at this number. Every single year, lung cancer is responsible for about 1.8 million deaths. That's more than any other cancer out there. It's a staggering figure that just hammers home the massive global impact of this disease. So you have to ask, what caused this huge spike? Well, the answer is overwhelmingly, shockingly clear. Research shows that a whopping 90% of all lung cancer cases can be traced back to one thing: smoking. The history of this disease is completely tied up with the history of tobacco. But, smoking isn't the only factor. That other 10% is linked to a bunch of other nasty stuff. We're talking about things like passive smoking, which can jack up your risk by 30%, and on-the-job exposure to things like asbestos and radon gas. Even air pollution and previous radiation exposure can play a role. Okay, so let's shift gears and talk about how this disease actually shows up in the body. How does it let you know something is wrong? Well, the warning signs can be pretty direct, but they can also be surprisingly strange. The most common signs are probably what you'd guess. They're all about the lungs. A cough that just won't go away is a big one, showing up in most patients, along with shortness of breath and chest pain. But there's one that's a huge red flag: coughing up blood. That's a sign that should never, ever be ignored. But here's where it gets kind of weird. Sometimes the body's warning signs are way more subtle and, frankly, bizarre. This is where we run into something called paraneoplastic syndromes. These are basically remote effects. They're caused by hormones or immune reactions that the tumor triggers, and they can show up in totally different parts of the body. It's almost like the body is sending out these coded messages from a hidden source. And these syndromes can be incredibly specific to the type of tumor. For instance, a small cell lung tumor might mess with your hormones, making your body hold onto water and causing dangerously low sodium levels. Or a squamous cell tumor could start pumping out a protein that makes your calcium levels shoot through the roof. These are the body's hidden clues. So, once some symptoms start showing up, what happens next? Well, this part is all about the critical process of actually confirming a diagnosis, and, just as important, figuring out exactly what kind of lung cancer it is. The road to a diagnosis usually involves two main steps. First up is imaging. A CT scan of the chest gives doctors a really clear, detailed picture of the tumor. But to be 100% sure, they need to get a tiny piece of it. That's the biopsy, and it confirms that cancer cells are actually there, and lets pathologists see them up close. And looking at those cells under a microscope leads to what is, without a doubt, the most crucial step after the diagnosis itself: staging. As this source puts it, figuring out the exact type and how far it's spread is everything, because that one detail determines the entire game plan for treatment. See, at the highest level, lung cancer gets split into two major families. You've got non-small cell, or NSCLC, which is the most common, about 85% of cases, and it tends to grow slower. Then you have small cell, SCLC. It's less common, but it's super aggressive and spreads really early. This one big difference means their treatment plans are worlds apart. And that brings us to the battle plan. This is absolutely not a one-size-fits-all situation. The treatment has to be tailored specifically to the cancer's type and its stage. For non-small cell lung cancer, it all comes down to when you catch it. If it's found early, the goal is a cure, and surgery is usually the main weapon. But if it's found at a more advanced stage, the goal shifts to extending survival and improving quality of life, using tools like chemotherapy and radiation. Now, for small cell lung cancer, it's a completely different story. Because this type spreads so fast and so early, surgery usually isn't even on the table. It's treated as a body-wide disease right from the start, which means chemotherapy is the main form of attack, often paired with radiation to keep the tumor in check. And this is where the field is moving so incredibly fast. We're moving beyond the traditional stuff and into much smarter drugs.
Targeted therapies are like these little smart bombs that hunt down the specific genetic mistakes driving the cancer. And even more amazing is immunotherapy, which doesn't attack the cancer directly. Instead, it basically takes the brakes off your own immune system so it can finally recognize and destroy the cancer cells itself. It's revolutionary. So all of this brings us to our final and maybe most important section. We've talked about what lung cancer is, but how do we stop it? How do we take control of this story moving forward? Remember this number, 90%. That's the percentage of lung cancer cases that are directly tied to smoking. This means the overwhelming majority of these cases don't have to happen. That isn't just a statistic, that is a powerful message of hope and empowerment. So how do we take control? Well, it really boils down to two key things. Step one is helping people stop smoking. It is by far the single most effective way to prevent this disease. And step two is all about catching it early. For people who are at high risk or talking long-term heavy smokers, we now recommend yearly low-dose CT scans to find the disease at its earliest, most curable stage.
And if you're wondering just how much catching it early matters, look at this. The 5-year survival rate for an early-stage non-small cell cancer can be almost 80%. But for late-stage, widespread small cell cancer, that number drops to just 2%. That huge gap is the entire argument for why prevention and screening are so vital. It really does save lives. And that brings us right back to our first question, but with a new perspective. Knowing that 90% of these cases are preventable, and with all these amazing new treatments coming out, what does the future of lung cancer actually look like? The answer isn't just in a lab or a doctor's office. It's in public policy, it's in our communities, and it's in the choices that each of us make. Thanks for joining me for this explainer.